Hey folks, Danielle Roberts here with Boomer Benefits, and today I'm here to talk to you about Medicare Advantage plans. In this video, we'll discuss how Medicare Advantage plans work and what the pros and cons are of these plans according to our policyholders. So after I go over the basics, I'll share some of the feedback that we've gotten from thousands of our policyholders over the years who've enrolled in these Advantage plans so that you'll know what things people tend to like about Part C Medicare Advantage plans and what things maybe they're not so crazy about. Be sure to stay until the end to get our free PDF guide about Medicare Advantage plans versus Medicare Supplement plans. There are two routes you can go with your Medicare. You can purchase a Medicare Supplement, which is also called a Medigap plan, or you can enroll in a Medicare Advantage plan. These two types of plans work very differently from one another, so choosing which route you will go is one of the most important Medicare decisions that you'll probably ever make. You can't have both, so you'll only enroll in one or the other. It's important to choose wisely because if you opt for a Medicare Advantage plan now, you may not be able to qualify for a Medigap plan later on after your one-time open enrollment window for Medigap plans has expired. Before we dive into the pros and cons of Medicare Advantage plans, here are a few things you should know about them first. The first thing to know about Medicare Advantage plans is that they are very easy to qualify for because they currently have only one health question, which asks about end-stage renal disease. People with ESRD do not qualify for Medicare Advantage plans in 2020, although that will change starting in 2021. There are two other current requirements for enrolling in Medicare Advantage plans as well. You must be enrolled in both Parts A and B before you can join any Medicare Advantage plan, and you must live in the plan's service area, which might be a few local counties around where you live, or in some cases might be as wide as a statewide network. Now, before I move on, I want to make sure that you notice what I said about Parts A and B because this is a big misconception that many people interested in Medicare Advantage plans get wrong. So you must be enrolled in Medicare and continue paying for Part B the entire time that you are enrolled in a Medicare Advantage plan. This is true even if the Medicare Advantage plan's premium is zero, which we'll discuss later in this video. Joining a Medicare Advantage plan does not get you out of paying for Part B. You'll pay for Part B, and then you'll also pay the monthly premium for the Medicare Advantage plan on top of that if there is one. So let's say you join a Medicare Advantage plan with a $40 per month premium. Medicare will deduct your Part B premium from your Social Security check as usual, or they'll bill you if you haven't signed up for Social Security yet. Then you'll also pay the $40 per month premium to the Medicare Advantage insurance company via whatever payment option you selected when you enrolled in the plan. So this brings up a good question. How do Medicare Advantage companies get paid? The answer is that Medicare pays them on your behalf. When you enroll into a Medicare Advantage plan, you no longer get your benefits from original Medicare. Instead, your healthcare providers will send their bills directly to the Medicare Advantage insurance company. The Medicare Advantage plan then becomes your primary insurance coverage, and that's why all providers must bill the Medicare Advantage plan. So, once you enroll in a Medicare Advantage plan, you should always file your red, white, and blue Medicare card away in a safe place somewhere. You don't want to accidentally present that card to a provider as a means of payment, because doing so will result in a bunch of denied claims from Medicare and a big mess for you to sort out. Since original Medicare is not directly paying for your claims anymore, you will present your healthcare providers with your Medicare Advantage member ID card for as long as you remain enrolled in that Advantage plan. Another important feature of Medicare Advantage plans is that they operate networks of healthcare providers. So unlike original Medicare, which has over 1 million providers nationwide, Medicare Advantage plans have smaller networks of providers in your local area. For example, a Medicare Advantage plan might contract with, say, 2,000 providers across 4 counties where you live. You will seek your treatment from these in-network providers whenever possible to ensure that you pay the lowest possible cost for your care. Some Medicare Advantage HMO plans don't even offer out-of-network coverage unless there is an emergency. With a Medicare Advantage plan, you'll pay a copay or coinsurance at the time of service whenever you access a healthcare service. These copays are set by the plan and will be listed in the plan's summary of benefits so that you can see before you join that plan what kinds of copays you'll be expected to pay as you go along. For example, you might pay $10 to see your primary care doctor or say $50 to see a specialist depending on the plan. The plan might also set your hospital copay at $200 per night, or perhaps it's just $500 for the whole hospital stay. Again, this is up to the plan and each plan will be different. Now, if your plan is a PPO plan and you do have some out-of-network benefits, keep in mind that providers in the network will be less expensive for you than providers outside the network. Now, let's discuss the network for just a moment. It's important to realize that you want all of your preferred providers to be in the network, not just your doctors. So if you like a certain hospital in your area, you should check to see if the plan includes that hospital in its network. Here's another example. Maybe you have a durable medical equipment provider that supplies your oxygen, and you'd prefer not to change that vendor because you've been using them for years. You should check to make sure that provider is also in the network for the Medicare Advantage plan that you ultimately choose. Many people often overlook this and then they're upset when they have to change their durable medical equipment provider or their home health care provider on the back end, or maybe they have to use a different hospital than they usually like. It's just something to be aware of. So that's some of the basics around what Medicare Advantage plans are and of course how they operate. Here at Boomer Benefits, I would say that about 85 to 90% of our clients opt for Medigap plans and around 10 to 15% opt for Medicare Advantage plans. So with thousands of policyholders on both types of plans, we've gotten lots of feedback from these policyholders over the years. They have shared their opinions on the pros and cons about Medicare Advantage plans, and now I can share these opinions with you. Here are some of the most common pros that we hear about from our clients who decide on a Medicare Advantage plan. The first one is that Medicare Advantage companies usually have lower premiums than Medigap plans. Medicare Advantage plans can set the price of their plans at whatever amount that they like. Remember, they're getting paid thousands of dollars by Medicare every single month that you are enrolled in their plan. So they can afford to offer you very low premiums or even no premiums at all in the hopes that you'll join their plan so they can get paid by Medicare. In return, you'll agree to use their network and you'll pay copays directly to your providers as you go along whenever you treat with those providers. This allows you to pay for medical care as you go instead of paying a higher premium up front for a Medigap plan for medical care that you may or may not need. If you're a Medicare beneficiary living on a fixed income and you're already paying well over $100 a month for your Part B, a plan that charges you no additional money to enroll can be quite attractive to many people. Remember that we said earlier that Medicare itself pays the Medicare Advantage company to take on all of your risk. So it's not that they're getting paid nothing, they get paid plenty to deliver your healthcare benefits to you. Another thing people say that they enjoy about their Medicare Advantage plan is having just one member ID card instead of a Medicare card, a Medigap card, and a Part D drug plan card. When you enroll in a Medicare Advantage plan that has a built-in Part D drug plan, you then just present your Medicare Advantage card at the doctor, at the hospital, at the pharmacy, and anywhere else that you get services. For these folks, convenience, of course, is a key factor. Next up, Medicare Advantage plans are easy to qualify for. There's only that one health question that we mentioned earlier about end-stage renal disease, and even that question is going away in 2021. So people awaiting a kidney transplant or who are on dialysis can't qualify now in the year 2020. All other health conditions are accepted by Medicare Advantage companies though, and this works out great for a couple of different groups of people. One is people who are on Medicare early, under age 65 due to a disability or an illness. In some states, these people cannot get Medigap plans or the premiums are so high for Medigap plans under 65 that they can't afford it. Medicare Advantage plans make a great option for these people who qualify for Medicare early. Another group that appreciates no health questions on the Medicare Advantage plan application is people who are not healthy enough to qualify for a Medigap plan. Maybe they missed their opportunity to get a Medigap plan during their 6-month open enrollment window for Medigap. So at 65, they were healthy and they decided not to get any supplemental coverage. And now a few years down the road, they develop a health condition. With just straight Medicare, they're shelling out 20% of all of their outpatient care, so they are starting to incur some pretty big medical bills. Now they try to get a Medigap plan to help pay for all of that, and they are shocked and dismayed to learn that they have to answer health questions now, and the Medigap company can decline their application. They may not be able to qualify for a Medicare supplement or Medigap plan any longer, but they can still sign up for a Medicare Advantage plan during the next fall annual election period, and that's one way they could go. The fourth feature that people often like about Medicare Advantage plans is that these plans have a cap on your spending for Part A and B services. This is called the out-of-pocket maximum limit, and it's designed to protect you. Each plan sets its own out-of-pocket maximum limit, but Medicare also limits the plans from setting that any higher than $6,700 for in-network services in 2020. Here's how the limit works. Every time you pay a deductible or a copay for healthcare services, the plan tracks your spending. If that spending reaches the out-of-pocket limit, you're done spending on Part A and B services for that year. The insurance company must now pay the rest of your covered Part A and B services through December 31st, and then of course everything will reset. Remember that if you just had original Medicare, you would pay 20% of all of your Part B services forever without end. So your Medicare Advantage company's out-of-pocket limit protects you from spending endlessly when a chronic illness happens. Lastly, Medicare Advantage plans are allowed to include some extras in their plan designs. We call these ancillary benefits, and they will vary by plan. Some of these benefits might include things like limited dental, some vision coverage, hearing coverage, and even gym memberships. For example, one plan might offer an annual preventive dental visit where you can get your teeth cleaned and have an oral exam for only $10. Perhaps another plan offers you a free eye exam and a credit of $100 toward your eyeglasses every 2 years. So you can see the benefits are limited, and they can be changed or dropped from year to year, but they are a feature that Medicare supplements generally do not have, and that of course is attractive to some individuals. Medicare now also allows Advantage plans to incorporate some benefits that fall into the at-home care arena. Advantage plans can include things like limited adult daycare services, at-home meal delivery, transportation to and from medical visits, and even home safety modifications into their plan designs. For example, you might find a Medicare Advantage plan in your area that will pay for the installation of bathroom safety bars in your tub or shower. While these benefits certainly do not replace the need for you to plan and pay for your future long-term care benefits, they are a new extra that you may find in some Medicare Advantage plans. What is covered will vary by plan. Keep in mind that these kind of extras may require prior authorization from the plan, and you'll need to use providers in their network like you do for anything, so be sure to read the fine print. So those are some of the features that our clients have shared with us that they like about their Medicare Advantage plans. Now let's address some of the cons or things that our clients have shared that they don't always like about their Medicare Advantage plan. Earlier we mentioned that lower premiums are one of the top reasons people join Medicare Advantage plans in the first place. However, Medicare Advantage plans often have more back-end spending, and people sometimes fail to anticipate this. Here's an example that our client service team has shared with me for this particular video. You go to a specialist with some complaints, and the doctor visits with you. He then wants you to go down the hall to the lab facility to get some blood work, and he orders a cardiac stress test. This gets scheduled for later that afternoon downstairs in the same building. You pay your $40 specialist copay when you walk in the door to the doctor's office, but what you're not expecting is the $80 bill that arrives in your mailbox 2 weeks later for the blood work the lab facility conducted, and a $150 bill for the stress test. You thought that all of these were included in the same visit since you never left the building. Unfortunately, those may be separate services and could all have their own copays under your plan. So your total healthcare service copays for the day amounted to $270. If this causes you to avoid seeking medical treatment because now you're afraid of what you're going to get billed, this is never a good situation. So yes, while that zero premium is enticing, you need to know that these plans are not by any means free. In a year of good health, you might spend very little, but in a year with higher medical usage, you might spend more than you would have on a Medigap plan. Let's compare that out-of-pocket risk against a Medigap plan. Medigap plans have higher premiums but more predictable spending on the back end. For example, people with a Plan G Medigap do not have any copays at the doctor or hospital. This means their maximum out-of-pocket for back-end spending on Plan G is $198 for the whole year, whereas on a Medicare Advantage plan, it could be as high as $6,700 in the network and more if you have out-of-network services. A person with Plan G would not have incurred any extra spending for the blood work or the stress test. Once they met their deductible for the year, the rest is covered. We've seen this scenario play out many times over the years, so if you choose a Medicare Advantage plan, you always want to check the plan's summary of benefits before you enroll so that you know your potential exposure for both in and out-of-network services on that particular Medicare Advantage plan that you're considering. Next up is that Medicare Advantage plans are not standardized like Medigap plans are. So while all plans offer the same Medicare Part A and B services that original Medicare does, each Medicare Advantage plan can set their own premiums, copays, provider network, drug formulary, pharmacy network, and out-of-pocket maximum. This makes them tricky to compare. While one plan may offer lower doctor copays but a pricey hospital copay, another may have a higher doctor copay and just one copay for the entire hospital stay. You need to study the details carefully before making your choice. Be on the lookout for anything where you spend a percentage instead of a flat copay, because those are things that might be bigger ticket items like outpatient surgery or chemotherapy. All right, the next item on the list of cons would be lock-in periods. When you join a Medicare Advantage plan, you're generally locked into the plan for the calendar year. You can only change plans during certain designated election periods or during a special election period that you may qualify for during certain circumstances, such as moving out of state. This lock-in period was designed to stabilize the market for the insurance companies. It encourages you to enroll when you have a valid election period instead of waiting until you get sick to sign up for coverage. It also prohibits people from trying to jump to better coverage as soon as they develop a new health condition. However, the lock-in period is something that many beneficiaries don't like because if they miss something important during their enrollment, they may not realize this until they are already locked in for the rest of the calendar year. Our next item is about network restrictions. Sometimes when someone has been on an original Medicare and Medigap plan for a few years, they've gotten used to being able to see any provider that accepts Medicare anywhere in the nation. Then they switch to a Medicare Advantage plan and they feel upset when they now have to deal with a network. Advantage plans typically have either an HMO or a PPO network. In an HMO plan, you often must get a referral from your primary care doctor in order to see a specialist. You also may not be able to treat with providers outside the network except for in emergencies, as we mentioned earlier. Let's say you need to see a doctor while you're traveling for a non-emergency reason, like a cold or a flu. If it's not covered because you are outside the network, you're left footing the bill. In a PPO plan, you can treat outside the network and you'll often pay more to do so, but you also must ask the out-of-network doctor if he or she is willing to bill the plan. If he won't, you need to find another provider. We sometimes see that an out-of-network provider fails to mention to the patient that they're not in the network. You then get an unexpected and unwelcome bill in the mail that you end up having to pay. Another network hassle has to do with provider contracting. Currently, medical providers can drop from the plan's network mid-year while you are still in your lock-in period. Now you have to find another provider for the remainder of that calendar year. You can see that this would be frustrating, so it's one of the reasons why sometimes people don't like their Medicare Advantage plans as much as they had hoped that they would. Next, we have prior authorization delays. With original Medicare, there's rarely a need for a prior authorization. However, Medicare Advantage plans seem to require prior authorizations much more frequently for certain tests, procedures, and also for surgeries. We have seen this sometimes delay that procedure for days or even weeks, which leaves people waiting for answers on potential health conditions. That rarely happens with original Medicare, so you want to be aware that prior authorizations may come into play more often when you choose a Medicare Advantage plan. Many Medicare Advantage plans charge you a coinsurance of up to 20% for certain items like durable medical equipment, Part B drugs, and cancer treatments. Though there is an out-of-pocket maximum on the plan to prevent you from spending beyond a certain limit in one calendar year, an end-of-year illness can result in a lot of money out of your pocket in a short span of time. Here's a scenario. A Medicare beneficiary is diagnosed with cancer in the fall and they pay 20% for chemotherapy. Within a few months, their plan's out-of-pocket maximum caps that spending for the year, which is good. But when January rolls around and everything resets to zero, if they're still taking chemo at a 20% cost, they can hit that cap again earlier in the year. If their plan has a $6,700 out of pocket, that could be potentially over $13,000 out of their pocket in the span of a few months. Most of our clients are on fixed incomes and they don't have the luxury of just working some overtime to pay off a debt like this. So be aware of the items on your plan that are more costly than others. Be prepared that an end of the year illness can sometimes create quite a bit of spending over just a few months' time. I like to advise our clients here that they should have a rainy day fund, some money set aside for medical emergencies like this one. I wish I could say that everyone who switches from Medigap to Medicare Advantage loves their choice in the long run. However, I've seen a number of cases over the years where a serious health condition occurs and then the beneficiary wishes that they had kept their Medigap plan. Returning to a Medigap plan is not guaranteed though, because in most states, you'll have to answer health questions to get back into a Medigap plan once your one-time 6-month Medigap open enrollment period has passed. Consider this scenario before you leave a Medigap plan to enroll into a Medicare Advantage plan. Unlike Medigap plans where benefits do not change from year to year, Medicare Advantage plans can change their benefits, premiums, copays, deductibles, doctor networks, pharmacy networks, and drug formularies each and every year. Over the years, some of our clients have complained that they find this exhausting. They would prefer to have the same consistent coverage from year to year and not have to worry about reviewing their annual notice of change packet and comparing the plans each year to avoid being auto-renewed into a plan that now has become more costly than it was in the current year. If you don't think you will want to take the time to sit down with your Medicare annual notice of change letter each fall to make sure that you're still happy with how the plan will change in the new year, then you might be happier with a Medigap plan where benefits do not change from year to year. All right, now you may have noticed that this list of cons was longer than the list of pros. Does this mean that Medicare Advantage plans are all bad? Well, certainly not. We have some clients that make the switch and are quite happy. However, what I've shared with you today is a true and accurate picture of the feedback that we've gotten from our own policyholders overall. I would caution you to keep in mind that there are rules to follow whenever you join a Medicare Advantage plan. While some people may view these rules as an inconvenience or as intolerable, others don't mind following them in order to achieve lower premiums. It's just that people don't always realize the potential expenditures or the hurdles that they may encounter in a Medicare Advantage plan. Now that you've watched this video, nothing should catch you by surprise if you decide to join a Medicare Advantage plan. Ask yourself a few questions though to determine what's best for you. What is your budget and what are your goals for your healthcare coverage? How many doctors do you have and how often do you see them? It's easy to find a Medicare Advantage plan that might work for you if you have just one doctor, but if you have 7, it could be trickier to find a plan where all 7 physicians just happen to be participating in the same network. Are you willing to change 1 or 2 of them if you join a plan where they aren't in the network? It may also be helpful to you if I share with you some of the situations where we often see people choosing a Medicare Advantage plan. Number 1, some people may not be able to make ends meet if they are spending $100 a month or more on a Medigap plan. In this case, a Medicare Advantage plan is attractive as opposed to having only original Medicare, because at least a Medicare Advantage plan has an out-of-pocket maximum limit to protect you from spending more than a certain dollar amount in 1 year. With original Medicare, you don't get that. Number 2, people with low medical usage often find Medicare Advantage plans attractive. If you only see your doctor once a year for a physical and you don't take any medications, you might view a Medicare Advantage plan as a better fit than a Medigap plan, where you would have to pay a monthly premium whether you use your medical benefits or not. Number 3, people with money set aside specifically for medical needs. In the event of a chronic illness, a Medicare Advantage plan is less frightening for people who have some money set aside than it is for someone who would be hard-pressed to pull together $200 for an MRI. Maybe you have a health savings account from your working years with thousands of dollars set aside specifically for medical use. Or perhaps you're the kind of person who will diligently take that money that you would have spent on a Medicare supplement and instead save it up for a rainy day in a special savings account that you don't touch unless it's needed for medical emergencies. If that's you, you might really enjoy your Medicare Advantage plan. Lastly, there are certain states like Florida where Medigap premiums are higher than average and where Medicare Advantage plans have richer benefits than in other areas of the country. These plans can often make good sense for people who live in one of those areas. Here at Boomer Benefits, I feel confident that when someone joins a Medicare Advantage plan through our agency, that number 1, they know what they're buying, and number 2, they will at least have our client service team to assist them on the back end with hiccups, questions, and concerns. This is really helpful for things like prior authorization delays that I discussed earlier in this video, because our clients won't deal with those alone. They can just call us for help. In closing, folks, remember that what's best for your neighbor may not be best for you because you have different budgets, different doctors, different health conditions, and different medications. Make your own decisions and do your own homework about these plans before you join one. Now, don't forget to download our free guide on Medicare Advantage plans versus Medicare supplement plans, which will give you more guidance on this topic. I'll put it in the notes below. Do you have a question about Medicare Advantage plans that I can answer for you? Type it in the comments, and of course, we'll be very happy to answer. Thanks for watching, and I'll see you in the next video.